Hello, my name is Jane Quinlan and I'm a doctor in the Oxford Pain Management Centre. This is the story, spoken by a patient and his wife, of someone who lives with chronic pain. He describes how his opioid medication was increased over the years and the shock he and his family felt to be told that he was taking a dangerously high dose of opioid. He talks about his fears about discontinuing the opioids, how he approached reducing them, and what that was like in reality. He talks about what life without opioids is like now, and his wife also shares her perspective on his journey. He talks about the weaning plan that we put together for him to slowly bring down his doses. And he also talks about the support he got from Catherine, the psychologist, who you'll also hear during this recording.
So I was wondering if we could start by you just sharing a little bit about the type of pain you were experiencing and how you actually ended up being on these high doses of opioids for pain.
Yeah, sure. Well, it started roughly, I suppose, 2004. Mm-hmm. I had to have an ileostomy because I had colitis bad, and I'd spent the best part of my life on steroids and other drugs, things like that. And going on from that, I suffered from fatigue quite bad. Again, without really knowing why, I just took it as part of, I wasn't doing very good and blah, blah, blah. I had a lot of lower back pain. I used to play in goalkeeper for football twice a week, and I used to play a lot of squash. So again, I don't know if that's part of it or whatever. I've got a bulging disc, which I've had for years. And I've had bad hip pain. I had arthritis in my hip. So again, it was multiple things. But without really knowing what the fatigue and the tingling and the things like that was, it was more of just get on with it. I was in pain, but I still enjoyed playing sports. And it wasn't until, I suppose, 2004, when I had the surgery, that everything changed. That sort of started off a string of events where everything was just hurting. Everything just hurt. I'd had multiple surgeries after that to do with my stoma. I had a lot of adhesions and I had a lot of stuff that wasn't right with it. Again, every time I had the surgery, I tended to feel these, what I now know was fibro, but I didn't at the time. The pains and things like that. My hip pain became excruciating. I was told I had arthritis in it. I had a bulging disc, which was causing me a lot of problems. It was really from then that the doctor started giving me opioids. Mm-hmm. So from 2014 was when I started on the opioids. It started off with the doctor giving me a fentanyl patch, which I had to change every 4 days, I think it was. But on top of that, she gave me Oromorph at 10 milligrams to use as needed. So on 2 different opioids. Yeah, I think it helped at the time. It took some of the pain away. But looking back, I wish I'd never started on it. But it was something that you said you'd noticed that it was helping.
Oh yeah, definitely.
The only thing that I did notice is I slept more. Even with the pain, I slept more. I was still commuting to work. I worked in London, so I was commuting every day. But it got to a stage around 2015 where it was just beyond a joke. It was just beyond a joke.
So your pain had got really...
Yeah,
really
it was. I was having to take more and more time off work. I was...
Couldn't cope with the pain?
No, I couldn't cope with the pain. I was basically getting in from work, going straight to bed, and then getting up the next morning, going to work, going home straight to bed. And it was too much. It was just too much. 2016, I suffered from quite bad depression, mostly because of the pain. Every time I suffered bad pain or had a massive flare, which again I didn't know at the time that I was having, I became depressed. And it got to the stage where I wasn't communicating with my wife. I would close the door on you, wouldn't I? Yeah. And just block the world out. And
spend all the time in bed.
Yeah, and it got to a point where basically I just shut myself off, and she let me do it because she knew that I wasn't in a good place, and she just made sure I was my needs were there. So I was fed, I was kept hydrated, but I closed the door. And, you know, it was something I didn't want to do, but it was at the time, that's where I was. My opioids had been increased by this time, and I was on a much higher dose. It was December of 2016 when I got the fibro diagnosis, which answered an awful lot of questions for me.
Definitely.
Because it was something that I think I've been suffering from for a long time without knowing, and it was really good to know what it was and what to expect and how. I mean, the doctor I saw at the Nuffield at Orthopaedic Centre, she was the one that told me, these are the symptoms and you've got 90% of them. So that to me was like a hallelujah. Yeah, I'm so glad that's, you know, it wasn't just me with my other medical problems, that this was happening.
It was something in its own right.
Yeah. So, and also when I asked her about the surgeries, and I seemed to have the big flares directly after the surgeries, she said that's not uncommon. So again, to me, you know, I wasn't the only one having that, and it wasn't something that I just thought, well, you know, it's just one of those things. But yeah, so that was doing that. It was around the same time that they changed me from the morphine to oxycodone. I so wish they never done that.
Definitely. Wrong thing to do.
But they told me, for me, it was still an opioid, but it would help me better than I was on for the fentanyl and the Oromorph. So I come off of those. I started on, I can't remember the exact dose, but it was around about 10 milligrams a day, wasn't it?
Yeah, it was very low.
But I found that the pain had increased significantly from the changeover. I honestly can't remember how much Oromorph I was taking, but I was getting through at least 2 bottles.
I think you just used to swig it out of the bottle
a month
instead of measuring it. Just
so again, they were on repeat prescription. So as and when I needed them, just took it. It was around about this time as well that I was retired through ill health. So I was basically dispatched from NHS. So
2015.
it was 2015. Yeah. So actually, that's going back a bit from then, isn't it? So
yeah.
So basically, from 2015, I took early retirement. That was when was it you gave up work for me?
That's a year now.
A year ago.
Yeah, January.
So
yeah,
though she was basically caring for me and worrying about me at home on my own when she was at work, and it got to the stage where she gave up work to become my full-time carer. And at that time, I was a lot worse than I am now. Not pain-wise, but in the place I was at.
Yeah.
So
with your depression was the worst.
Yeah.
And so the opioids, you said that when you changed from one type of medication to another, your pain increased, and then you started taking.
So of course I
more
went to the GP and I said, you know, I'm in a lot of pain, blah blah blah. I explained fibro, and I don't think at the time the GP I was under knew much about fibro, and it was just a case of, well, take another 10 milligrams. So every dose take another 10 milligrams, and that went on and on and on. And it got to the stage where I was on 30 milligrams 4 times a day, and didn't even think twice about taking it. It was the doctor that told me to take it, and that's what I did. I just did as the doctor told me. The pain probably wasn't any better, if I'm being truthful, and the only thing that I found was that I slept a lot. Didn't I?
Definitely, yeah.
And did you notice anything as that dose was increasing?
As it was increasing, he was getting more sort of fatigue and sleeping sort of all day, spending more time in bed.
Yeah.
At one time, it's like, I think about 5 months he spent in bed.
Yeah.
And did you make that connection at the time with
No.
that being related to the medication?
We just put it down to
It's
depression,
fibro and depression.
and the fibro, and then my hip and everything else that went with it. It wasn't
all combined together.
Yeah,
So it sort of crept up on.
Yeah. I mean, I had the back pain I'd had for years. I'd had injections, and the first lot I had here were fantastic. For the 6 months I had those, I'd be able to work pretty much, you know, as I wanted to. I came in for the second lot, didn't even touch it, didn't even know I'd had them, and that was when they said, "Well, we need to put you onto these." So that for me was a big change.
So it sort of crept up into this time when you were
Yeah.
on a really high dose and
Yeah.
sleeping a lot. And so what led you to realise that and have that point where you realised, actually, I'm taking it a lot? Could you tell us a little bit about
It was when you was
that?
in hospital having your hip done.
Yeah. I had to have a hip replacement done.
Yeah.
So they took me in in August of 2019 to have this hip done, and I had to ask the nurses for my opioids because for some reason they couldn't get it through the pharmacy, so I had to take mine in, and they obviously locked it quite away because it was an opioid. And they gave me my paracetamol and whatever drug thinning things they gave me, and I had to ask them for this opioid. And I'd love to meet her again.
The pain nurse.
Pain nurse.
So someone came from the pain.
Yeah,
from the
somebody
pain.
somebody from the pain management team came to see me, and I'm not going to lie, she was very blunt.
She was.
Very blunt, and it wasn't a case of hello, I'm so and so, can we have a chat? It was, you're on opioids and you need to come off of them now.
Because he was on far too high a dose.
And
How did that feel to sort of suddenly?
Shock.
Yeah, it was, because as I say, she was very blunt. She was very to the point, and my wife and my daughter were visiting at the time. She did ask, I'll give her a due, she did ask, is it okay to talk with you? And I said, yeah, of course it is, family. And then she said, you need to come off of them, and you need to come off of them now. And I said, am I on a dangerously high dose? And she said, yes, you are. And she went on to explain what could happen if I kept taking them. And
Do you remember what she?
Yeah,
Yes.
we asked, didn't we?
Yeah, we asked.
The first thing was I was at a much higher risk of sudden death.
Kidneys, kidney failure.
Kidney infection, kidney problems, sorry, not infections, kidney problems, spleen, liver, and everything else that goes with it.
Loads.
Addiction, a much higher chance of addiction.
And was that something that you'd been sort of aware of up to that point?
We weren't
No,
told by our
absolutely
GP.
No, after she's basically come out and told us that, you started crying your eyes out, my wife. My daughter did a runner. She basically broke down and she ran out. And I did say to her, I said, am I a drug addict? And she said, but not really, because you were put on them by your GP, but there is a much increased chance of further addiction. And I said, okay, I'm going to stop.
So in that moment,
It was.
You
I
decided
think. Yeah.
I've
I think.
got to
I'm
stop.
not. I'd love to know how I would have felt if you and my daughter hadn't been there, because it was their reaction straight away,
right?
and I just said, right, that's it. I'm going to stop. So I asked her. I said, okay, how do I go about stopping? And she said, you need to do it through the pain team. So she said, carry on as you're taking them as you are. I'll speak to the pain team and I'll get you an appointment, and there is an opioid reduction clinic, and we'll do it through them.
We had to wait a while, didn't we?
We
for
did,
the
yeah.
appointment.
But it was at that time, that's when I started worrying.
And what do you remember at that time? What some of those concerns were about that process?
Yeah.
What was going through
Well, the
your
first thing
mind?
was,
The withdrawal symptoms, you thought, God, am I going to get bad ones? Or?
yeah. I'd only had one drawback, because my GP had put the branded oxycodone rather than the generic oxycodone. The pharmacist that we used was very good, and he always kept stock. For some reason, they'd run out. I went to get them on the Friday, didn't have any, wouldn't be in until the Monday. And I did have withdrawals.
What did you notice?
Anxiety was the big one.
Yeah.
Shaking. The need to take one.
You felt that?
I felt that need.
that
I did
need
feel
to
that
take
need.
it.
Yeah. I wouldn't say I was desperate,
No.
but it's to the point where I needed to take the next dose. He was very good. When I explained what dose I was on, he gave me, I can't remember what it was, but he gave me a lower dose to last me till the Monday. I think I had to pay for it, if I remember rightly.
Yeah, we had to pay for it.
And then I went on the Monday, got the tablets, back onto the normal dose.
So was that what was coming into your mind when you started thinking about coming?
Yeah, there was the...
Having those withdrawals and then thinking, gosh, am I going to get any worse as I reduce them?
Yeah, I mean, the first thing she said was that being on the opioids wouldn't make that much difference to my pain. And I'm not going to lie, I called her a liar.
Yeah, you did.
I'm not going to lie, I was, she was blunt with me, so I was blunt with her. And I said, I'm sorry, but how? You know, if I'm in this much pain now and I'm needing that much opioids, how the hell am I going to cope with none? And what level do you want me to get down to? And she said, no, you come off of them. And I went, completely? And she went, yes. And I went, no chance, absolutely no chance now. And she said, well, it may well be that you can be on a lower dose. She said, but ideally, we want you off of them. Okay, we'll see.
What were you thinking at that point?
Yeah, well, it was a case of, I didn't think. I honestly didn't think. I called her a liar. And I honestly didn't think that because I've been on them so long and relied on them so much that it would make any change to me, it would make any difference. And if anything, if I was lying in bed for 5 weeks without getting out of bed, without them, is that my life? Do I lay in bed all day? Am I going to be that bad?
You thought that, didn't you? I'm
I
going to
did.
be in bed permanently now.
Yeah, and it was only really you saying, you know, well, you got to try, you can't. And I said straight away, as I say, you know, well, we'll try it, we'll give it a go, see how it goes.
So it was seeing your reaction, your wife's reaction that really
and our
gave you
daughter,
that.
That
made him.
Yeah, I think
I've got to come off of
I
it.
don't know how I would have reacted, but I think straight away, for my own benefit, I would have said, okay, yeah, I will come off of them. Whether I straight away would have said, I'll come off them now, I don't know. But I had the support there, and I see the reaction of how it was acting on the rest of my family. So I just, okay, let's do it.
So how did that? So you made that decision then that you were going to, give it a go, despite the reservations that you had and the sort of scepticism that you had about what you were told about how that would go. So how did you actually sort of commence that process of tapering?
Well, I'd say that was August. I had my hip done, and I couldn't get an appointment with the pain management team until the following July. So I see a Dr. Frampton here at the Opioid Reduction Clinic, and we had a long chat, and basically it was, you need to come off of them, as you know, and she again explained all of the pros and cons of coming off of them.
And by that point, because you'd had a bit of time then in between, were you still feeling the same level of sort of doubt about that, or had you?
He was. He was. He's really worried.
I was concerned about the amount of time between that nurse telling me that I needed to stop and actually getting the appointment. But I didn't think straight away, you know, I've got to come off them, I've got to come off them, I've got to come off. But it was really the recovery of my hip. That's why they said you can't come off them straight away. You need to do it slowly. You need to do it in a controlled way. But you need to do the rehabilitation for your hip. You need to do this. You need to do that. So I understand why the gap, and I understand that the NHS is very busy. But so it was July of 2020 that Dr. Frampton said, right, you need to reduce, and the way to do it is gradually. And I thought over 6 weeks maybe, because I'd actually spoken to my GP before I had this appointment, and I said, look, and she suggested over a 3-week period, and I just went, absolutely no chance.
So that's what you maybe had in your mind when you were coming.
No way.
So I was thinking maybe over a month, maybe a couple of months, and then when Dr. Frampton said no, you reduce by 10 milligrams per week. I went, okay, that's what we do then. And we went home and we discussed it, didn't we?
Yeah, and worked it all out.
And we said, okay, how do we do this then? So I think it was your idea, got me a little blackboard, just about the size of a computer screen. And she said, right, we'll put your dosage at the top, and we'll put how much you take each dose to make up the daily and the weekly dose. And then I worked out exactly which tablet to cut down. And to begin with, I instead of taking 10 milligrams per week off of one dose, I took sort of 2 5s. So it was a real gradual. So, and it worked.
I think if it would have been too quick, I think it would have had a lot more
when she said 3 weeks, and then when he told me that, I just thought, it worked. It worked.
And how was it with the withdrawal symptoms, doing it in that way?
I didn't have any.
You didn't have that?
No, I didn't have any.
Was that a surprise?
It was a big surprise.
Big surprise. Big surprise.
he would have a
No,
lot of
and actually at the
withdrawals.
end of it, I finished it about 3 weeks earlier than I should,
He did.
because I should have taken. It got to a stage, instead of taking 4 tablets, I had to cut one of those ones out, and I thought, am I going to be all right? And I did the last one at night, and I thought, okay. So the next morning I got up and I didn't feel any different. I had no withdrawal symptoms, so I thought,
I'm not
okay,
taking it.
I won't take that one tonight either. And I dropped that one, and I dropped that. So yeah, so actually I finished it 3 weeks earlier than I should.
You should have.
So,
And how long was that whole process then?
right, it was a long time, yeah.
It was over a year, wasn't it?
I started reduction in July of 20, and I actually finished in February 22.
22.
So I think it's around about a year and 7 months in
Yeah.
total. I did have support from the pain clinic. They were very, very good. The nurse phoned once a month, just basically asked what my dosage I was on at that particular time, and
I'm checking that you were okay.
checking I was okay, how was I feeling, how was the pain, blah, blah, blah. Only once in all of that time did I get flustered. I was telling her exactly what I was doing and how much less I was taking, but it was at one point, it was towards the end, and no matter how I tried to work out, I couldn't get across what tablet I was stopping taking to meet that week's dose.
I don't think she understood you, did
And
she?
no, she kept saying, she was telling me this thing, and I was saying, no, that's not what I'm doing it this way. And then she would repeat it, but it wasn't what I was trying to say. And I lost my temper, and I said, sorry, I've got to go, and I put the phone down.
Put the phone down on her.
So, again, I'm sorry for that, but that was at the time, that's what
I think she did phone you back, didn't she?
She did phone me back. She said, "You're okay," and I said, "Yeah, I'm so sorry." I said, "I said I know what I'm doing. Please let me carry on as I'm doing it." I said, for some reason today I cannot get that across to you what I'm doing," and that was the first sort of thing I thought, "Hang about, yeah, that doesn't sound quite right." And I think I was having a flare, and I think I had the fibro fog, because it should have been a simple, I've stopped taking this tablet, I've stopped taking that tablet, but I couldn't get that across.
So still some sort of a few challenges along
Yeah,
the way.
yeah. But again, as I say, she was very good. You know, she I think she fully understood that I couldn't do that, and then she phoned back and said, "No problem. You know, you're on track. Well done. I'll give you a ring next month."
So you had those monthly calls.
Yeah.
And I was wondering, as you were, it was quite a long period of time that you were reducing. Could you feel any benefits at that time, or not?
Personally, the pain was no different.
No.
The flares I would get, I tend to have I call it a background pain with the fibro. It seems to be there all the time. But then I used to get really massive flares to the point where I was curled up in a ball and I didn't get out of bed, and it would take me 3 or 4 days of total fatigue where I couldn't move.
That was when you was on the oxycodone.
Yeah,
That used to happen.
But that was during the decreasing
Decreasing
process.
as well, yeah.
So, I was still getting the pain, but I wasn't getting any more pain. I didn't see an increase in the pain. It was still there. Yeah. So I didn't really notice. No, which I was very surprised at, I must admit.
And did you notice any benefits during that reduction, or was it the same for you watching from the outside?
He was getting better. A lot.
So you
He
could
was
see
getting better. I could see a
changes.
difference.
What could you
Definitely.
notice?
We made a few notes because she's a little bit nervous, bless her, but that's...
Yeah, I noticed that his mood was better since he was reducing the oxycodone, and we was sort of going out more.
Right.
Only a couple of times a week, but
Yeah,
it was still.
I wasn't laid in bed all day.
Yeah, and he wasn't laid in bed all day because at one point he was in bed for 5 months, not getting up.
Yeah.
So I was taking his breakfast, dinner, tea up to him, and making sure he had plenty to drink.
So you could sort of notice that from the outside.
Yeah,
As
yeah,
the dose was
definitely.
coming down, you could begin to see those changes.
Yeah.
And then sort of when you completely come off of it, notice that he's helping more sort of around the house, like preparing the veg and stuff for me.
Yeah, and I was going to ask that
And
because
getting
now,
up and sitting downstairs as well.
Yeah.
because
I
now
think-
you've been, as we speak now, you've been off them for nearly 9 months.
Yeah.
Yeah.
9 months. So having sort of completed that process and then had some time afterwards, could you tell me a little bit about, from that day when you took that final tablet to now, what's that been like? Sort of beginning, moving forward?
If you think that when I was on the highest dose and I'd started to come off of them, I was so sceptical about the pain increasing when people, nursing professionals were telling me they're not. And she used to get my tablets out for me. I've got a little bowl and I've got a day-to-day tablet which we make up weekly. And we did that, and then we made sure that the dosage that I was on was done. And a couple of times I wasn't in a good place. My depression was bad, and I just said, I can't do this, I ain't doing this.
Is this during the reduction?
Yeah, and she actually removed.
I used to take them out of the bedroom.
Yeah, I've got a little drawer where I keep all my tablets and medication in, and she actually took them out.
You needed to.
And she said, you know, there's no way you're increasing it again. You're not going back on these. And I probably swore a little bit.
Yes.
And we had a little discussion, shall we say? But I didn't. And
no, you didn't.
No, I didn't.
Never ever.
No.
So there was a few moments when you had to be the one that was keeping things on track because it was feeling.
I don't know if I would have taken them.
But you didn't go back on yourself.
But there was a thought of taking them because I was in so much pain.
But you didn't.
But you just basically said, you ain't having them. I'm taking them.
And I'd get them out what dose you needed.
Yeah.
And bring them to you.
Yeah.
Instead of you keeping them in the bedroom.
Yeah.
Which was better.
It was.
A lot better.
Yeah.
And I know we've talked about the fact that you were sort of prepared for the fact that it might take some time after you'd completely discontinued before you'd fully feel the benefits.
Yeah.
And
but they told me 6 months. They told me from the last tablet it would take roughly 6 months to get the opioids out of my system. And I suppose really looking back it probably did.
Yeah.
There was a couple of times when I thought, you know, do I take a couple just because of the pain? Yeah. But I didn't.
But you never did.
No, from the day I finished, 24th of February 22, I didn't take a single tablet, and I haven't taken one from that day to this.
One since.
What changes have
really
you
good.
noticed?
A lot more going out more.
Well, she used to call me a zombie.
Yeah, I used to call him a zombie.
She did, because I couldn't concentrate. No, I couldn't read because I couldn't remember where I was. Now again,
go back on the book, didn't you?
Yeah. I used to read a couple of pages and I couldn't remember what I read, so I had to go back to that. Now, was that the fibro fog or was that the high dosage of the oxycodone?
I think it was a high dosage.
Yeah, I think it probably was, because I can read fine now. I can read fine now. So yeah, it was. I just wish somebody had told me.
I watched that Dope Sick, didn't I, about the oxycodone?
Yeah, I was going to
really
talk about that at the end of it, but yeah.
It was.
And if you were sort of had something, you know, if you were talking to someone that was just at the start of this, maybe they just had been told what you were told, that, you know, you need to come off. Is there anything that, you know, with your experience you would
I would say do
say
it.
to them?
Do it. Definitely do it.
Do it. You need somebody like that nurse to tell you straight.
Blunt.
Be very, very blunt with you. And she didn't call me a drug addict.
No.
But it wasn't far off. She did.
Very close.
Yeah, it was. She, you know, and it was unintentional. But looking back, the amount of oxycodone I was on. I mean, I remember I was in hospital one time and I was on the full dose, and I had a problem with my stoma. And they brought a lad in, and he was opposite me in the bed, and he was a morphine addict. And he admitted that he was only there because he knew he could get dosage of morphine. And when he found out that I was on oxycodone, I was badgered by him. Can I have some of your oxycodone? Can I have some of your oxycodone? And that's when I really realised, hang about, this is. And I spoke to the nurse, and the nurse moved me. She just said, I'm so sorry you've had to go through that, and I was moved to another room. But you don't think about it. You just take the pills that your doctor tells you. But if somebody's going through it, I would say do it. Talk to people, which I'm not a talker. Well, I wasn't until I met you.
So we met Catherine.
But yeah, I mean, it never even occurred to me that I was on a high dose till she said. And then it was a case of, okay, I need to come off of these and I need to come off them now. But no, I would say do it. Get support from your family.
Yeah, definitely. You
And
need
as a family member,
support.
what would you say to other family members? Because it's
Just help them all you can to come off of them, because they're not good.
They're not good.
Not at all.
No, and I'll hold my hands up and I would say the pain isn't any worse.
No.
It is sometimes, but I think I'm progressing with age.
Yeah.
I'm not a young chicken anymore. And I get the aches and pains of a 60-year-old, but I think the fibro has probably got a bit worse. But there are other medications and therapies out there. And with the help of the pain clinic team, you can do it. You can do it. And it's taken a little while, but they've changed my medication 3 or 4 times, but now they found one that's working.
Yeah, it is working.
And my depression's a lot better. I can talk. I mean, I wouldn't be able to have done this in a million years if I was on the oxycodone.
Can't stop him from talking now.
Right?
And was there anything else that? Thank you so much. And was there anything else that you wanted to sort of to add that we haven't covered?
Yeah, well, because I used to get depressed, and depression was, I've always had it. I've had it for as long as I can remember, but it was always triggered by ill health. And because I had this colitis for so long, I think it was sort of that started it. But then I've had other medical problems. I've had kidney stones, I've had bulging hips, I've had this, I've had that. And I was never, ever one for talking. I tried the, I can't remember the talking spaces.
Yeah.
They told me that I could do it in a group. No chance, absolutely no chance I could talk in a group. Opt-in, I tried them over there. Tried that. It worked to a point, but again, it was in a group. Couldn't do that.
You can't do group talking.
So when I came to see your boss,
Yeah.
can't remember Emily, and I had a session with her, and she said about seeing a psychologist, and I thought, no, can't do that. Anyway, we come, didn't we?
You said, no, I can't do that.
I didn't want to come. It was her that said,
Yeah,
you need to go.
said, you need to go.
So I saw Emily. And I think you were there. I think you were in there. And she said, you're a trainee, you're going to, you need somebody to give you a hand and to see somebody, and it would be beneficial for me to see you. So I thought, okay, well, give it a go. I'm not going to say much. I'll probably, the honest truth, I said to you, didn't know that I think I'll probably go in there and I would just sit there and just say, yep, no,
yeah,
no. But no.
It's not been like that at all.
It's not been like that at all. You put things in place that, although they're simple, I wouldn't have thought of in a million years.
No.
Things like pacing. I keep going back to pacing.
Yeah.
So when I'm having a good day, I don't keep going. I'm having a good day, I'll do this, I'll do that, I'll go do this, I'll go do that.
No.
It's do this, rest. Or if I have a long day, you have a rest day the next day.
Yeah.
And that's giving me, I'm not where I want to be, but I'm in a lot better place than I wanted to be.
Yeah, a lot better.
So there's things like that, and there's things like dropping the anchor, which you've talked about, and there's other things that you've said to me about that I've taken on board, and I still spend quite a lot of time laid down, but not all day. I'm out of bed most days. Well,
yeah.
I do have flares. I still do have flares, and I do have to lay in bed all day, but it's probably once a month, if that now. So they found this new medication that they put me on. I don't know if you really want me to name it, which is agreeing with me. She says I've never been this jolly.
Yeah.
for a long time.
For a long time.
And I joke about
ribbing me all the time.
Yeah. And before I would looking back, I was a zombie.
Playing with your grandson.
Yeah, I play with I wouldn't have thought.
He keeps you on your toes.
He certainly does. But yeah, I wouldn't have thought I could be in this place where I am now when I was on such a high dose. You
wouldn't have been able to do the 2 weddings.
No. My daughter got married up in Scotland, and for me that was big. I really didn't think I'd be able to do that.
Big thing, wasn't it?
But I did. And then my son got married in December. It was only up at Banbury, but again, I think the first one.
Long day.
It was a long day.
It was good.
But no, I'm walking now. I think when I first started seeing you, I was on about 600 steps or something like that, silly. I'm on over probably 1,000 now. I was dragged around town the other day, so I did 4,000. It was in stages, it wasn't in one big lump, it was in stages.
Down.
But no, it's been good.
It's been good.
So it's been such a journey of,
Yeah.
it wasn't
Coming
a
off
month,
of them.
like you
No,
released it, but
yeah.
you've taken the time
Yeah.
and
Yeah.
got to a really different place.
Yeah, but I mean,
I
looking
think
back,
it's better doing it slow.
yeah, looking back, it's. I'm still angry at the system. I'm still don't understand why they put me on such a high dose, knowing that I was on such a high dose, and I had no reviews. Nobody ever called me in for a medication review or to say, you know, you need to stop taking these. And it wasn't, as I say, it wasn't until that nurse, when I had my hip done in 2019, that said, bang, you need to stop. Yeah. And as my wife said earlier, if anybody is on these drugs on that higher dose, watch Dope Sick.
Yeah, watch the Dope Sick.
Because that, I mean, you watched it first and you said to me
last
about
year,
it.
Yeah.
And just see where that's going to take you.
Awful. Yeah.
Just see where that can take you.
Definitely.
So, but with the support, you know.
You can do it.
Yeah.
Do it.
People tell me that there's not that many people that completely come off of them, and I did really well. But to me, it was just a case of having to.
Years ago, it was thought that opioids, drugs like morphine, oxycodone, fentanyl, tramadol or codeine, would help patients with chronic pain. So many doctors prescribed these drugs for their patients and often increased the doses over the years. We now know that opioids don't help chronic pain and actually make life worse, not better. Opioids cause side effects like poor sleep at night and feeling sleepy during the day. They affect your memory and concentration, they cause constipation, they can reduce your immunity and make you more likely to get infections. They affect your hormones, they increase rather than decrease your pain sensitivity, so pain is worse, not better. And they can cause addiction and increase the risk of early death. Opioids cause dependence, where your body gets used to them, so can produce withdrawal symptoms if you stop them too quickly. So many people feel scared about reducing and stopping opioids, especially if they've been taking them for many years. We help patients to slowly reduce and stop opioids.